Hi, I'm Mike Hughes. Welcome to Clyde Ellis Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. Today's guest is Dr. Ajay Chaudhuri, the Medical Director of the Diabetes Endocrinology Center of Western New York and the President of the Leadership Board, American Diabetes Association here in Western New York. Dr. Chaudhuri, thanks for joining us today.
Thank you, Mike.
Tell us a little bit about your practice at the Western New York Center.
So our practice at the Western New York Center is really the diabetes center, where we have three providers who are MDs, experts in treating diabetes, two nurse practitioners who are also committed to treating diabetes. And we have two certified diabetes educators and dietitians. And really, we have a committed team right from the time that you walk in, and with the front staff and all the nurses who are committed to really providing care for people with diabetes.
Right. So diabetes is a well-known name. It's probably something along the lines of one of the most common illnesses, so to speak. Tell the viewers who may not know, what is diabetes?
So diabetes is defined by, if you check your blood sugar and it's elevated beyond a certain level, that defines that you have diabetes. And the important part of this disease is that if blood sugars are elevated to a certain level, it increases your risk of developing problems in the future. So for example, people with diabetes are very prone to develop problems with their eyes, their kidneys, their nerves. And also, 80% of people with diabetes develop problems with their heart. So it's a disease that is reaching epidemic proportions now. Right now, there are 1 in 10 people in the United States that has diabetes, and 1 out of 3 are at risk for developing this problem. We are predicting that unless we do something to stop this disease, every baby who is born today, they have a 1 in 3 chance of developing diabetes by 2050. So It's really reaching epidemic proportions.
Talk a little bit. You talk about babies who are at risk, but there's an early onset diabetes. Talk about the difference, type 1, type 2 diabetes.
Yeah. So type 1 diabetes is a problem where you have elevated blood sugars because one of the organs in your body that produces a hormone called insulin gets destroyed. So you're not producing any insulin at all. And the only treatment that is available for people who have type 1 diabetes is giving them insulin, which is this hormone that they're deficient in from outside. Type 2 diabetes, on the other hand, is a disease which develops relatively, I would say, more in young adults and older people, where the problem is not only that the body is not producing enough hormone, but they are also, any hormone that is being produced, they are not utilizing that properly. So a lot of the times, initially, you can put people with type 2 diabetes on oral medications before they have to go on to injectables. But I can tell you that there is nothing called early diabetes or mild diabetes. You got to take this very seriously if your blood sugars are elevated beyond a certain level.
Gotcha. So you talked about diabetes is reaching epidemic proportions. Is Buffalo, is Western New York, is the Northeast seeing that at a faster rate? Are we further at risk than most of the country?
Yeah. So the data as far as Erie County and Western New York is concerned is that the risk or the prevalence of diabetes in Western New York is slightly higher than the national average. So out here, there are approximately 11%, so a little bit more than the 10% that I was quoting, that are at risk for diabetes in this particular region.
So sedentary lifestyle, food, I mean, those are all factors that play into that?
Exactly. So, it's good that you brought this up, because when I talk about people who are at risk for developing diabetes, and if somebody finds out that they're at risk for developing diabetes, and that's as simple as sometimes going to the American Diabetes Association website, plugging in certain numbers which include your family history, your age, your weight, and it gives you risk assessment as what your risk is. And then clearly your primary care provider can do a simple blood test to find out whether you are at risk. And if you find that you are at risk for developing diabetes, just by walking 30 minutes every day, 5 days a week, you can reduce your risk of developing diabetes by 58%. This is a program called the Diabetes Prevention Program. So what I usually tell people is really try and make sure that you're following a healthy diet. And I really don't talk about it as a diet that is for somebody at risk for diabetes or who has diabetes. Really, it's a healthy diet. So all of us, as you know, are trying to limit our carbohydrates, increase our protein intake, reduce our fat intake, and really just go out and at least make sure that you're walking 30 minutes every day, 5 days a week. I know it sounds that, oh, of course I'll be walking 30 minutes every day, 5 days a week. But, with the weather that we have, with all the conveniences that we have, sometimes we drive to our neighbors' houses. So,
right.
So just start walking 30 minutes every day, 5 days a week, and that is going to reduce your risk. So you don't have to lose tremendous amounts of weight to get the benefit.
So are the complications really the typical sign of someone with diabetes? They're losing their eyesight, things like that. Is that really how your patients will come in, or they're referred in by their primary care doc because they're having some of those complications?
Yeah. I think this is a great question. Really, we talk about diabetes as a silent killer. And our goal really in our center is really to prevent these complications. And I can tell you the first thing that we tell our patients when they come to our center is that just because you have diabetes does not mean that you're going to get these complications, because all these complications are preventable by aggressive treatment of blood sugars, blood pressure, and cholesterol. And that is what the ABC is. The A stands for A1C, which tells us about how your blood sugars are controlled. The B stands for blood pressure, and the C stands for cholesterol. So the first thing I tell people with diabetes is, first of all, that if we get your ABCs under control, you are not going to develop these complications. And with the kind of treatment that we do in our center, we have actually been able to even reverse some of these complications. Now, clearly, there are still going to be some patients who have not controlled their A1Cs who will come into our center with complications, but hopefully, I would like to see these people before they develop the complications, right? Because that is really what our mission is, and that is what our vision is, right, in the center.
So your practice, as you talked about 5,000 so patients, diabetes is a more and more common illness or disease that you hear about. Is there still stigma attached to it, or do you think it's becoming more mainstream and people understand that this is a very serious issue and it's not to be stigmatized like that?
Yeah. I think this is a great question, Mike. And I have always felt that one of the reasons people with diabetes sometimes don't take charge of their own illness and don't, and the blood sugars are not controlled because they feel that they may be responsible for the high blood sugars. And one of the main things, again, that I tell people when they come in is that clearly lifestyle changes are important. Because without lifestyle changes, we are not going to be as successful in getting your blood sugars under control. But right, just remember that there are other things that are going on in your body that is not allowing the sugars to be under control. So, don't feel guilty about having diabetes. Take charge of it. Understand that this is something that can be controlled, and we will do it. We will do it. It will take a lot of effort from our side, and it will take effort right, from your side, but right, we will be successful.
Right. You refer to the we often with your center, with your team, with the other physicians and the staff on there. The West New York Diabetes Center is thriving right now, and you're seeing a lot of patients. You're on the cutting edge of technology and treatments. Talk a little bit more about the growth of the practice and how it's evolved and the location change.
Yeah. So, we started off in Millett Fillmore Gates. The founder of the center, as you know, is a world-renowned endocrinologist, Dr. Dandona. We started off in the basement at Millett Fillmore Gates. As the practice grew and the reputation grew, We went to the penthouse on the 10th floor of Millet Fillmore Gates.
Right.
Beautiful setting. And now we have, a beautiful center right on Maple Road, very, very visible, where, we have clearly, room to see the number of patients that we want to see and provide all the technology and resources that are required, for treating people with diabetes. And that is why I always say we, because diabetes is not treated just by a provider. It's really treated by a team.
Right. Your practice and what you guys are doing, the treatment of diabetes, this is another example of where people don't have to go elsewhere. You don't have to go to Pittsburgh. You don't have to go to Cleveland. You don't have to go to Rochester to be treated. We have these services. We have the cutting edge technology. We have the physicians here in Western New York. Talk a little bit more about that in terms of why people should stay here to be treated.
I can tell you, in terms of diabetes, there is no place that people will get better treatment of their disease than Buffalo. And I can say that, I can compare our standards of care to Cleveland, to Mayo Clinic, to Joslin Clinic. In our center, in the last 20 years, with the kind of treatment that we have given to people with diabetes, we have not seen a single foot ulcer in our clinic in people whom we have treated. We can count on our fingers the number of people who have gone to dialysis. We can count on our fingers the number of people who have lost vision. So we are very proud of the outcomes that we have achieved. And as I said, right now we are at a stage where we are actually reversing the complications of diabetes, which has not been described even in textbooks, etc.
Right.
So for people with diabetes, I can say very confidently that the kind of care that you will get in this center is going to be better, not only as good, but is going to be better than any other center in the United States and in the world.
Right.
And at the same time, because of the research that we are doing, people are sometimes getting treatments that are not available in other places. For example, recently, in the last 6 years actually, we have developed an innovative treatment for people with type 1 diabetes. We are using medications that were approved for treating type 2 diabetes in people with type 1 diabetes. And that has improved the control of people with type 1 diabetes substantially. Recently, in a trial that was where the principal investigator was Dr. Dandona, based on the research, that medication has recently received approval for treating people with type 1 diabetes in the European Union. And we believe that hopefully that treatment will be licensed for treatment of people with type 1 diabetes in USA.
Right.
So we are really pioneers in care of people both with type 1 and type 2 diabetes right now.
So there's an awful lot of people that you're treating, but it's also an exciting time with the research that's out there, the education that you're providing. It's a team approach. It's aggressive attacking of diabetes. Tell me what's next on the horizon for the center and for the practice of caring for diabetes.
Yeah. So what we are really excited about right now is, some of the technology that is coming in for treating people with diabetes. I've been treating people with diabetes now for almost 25 years. Right now we have technology where people don't have to check, don't have to prick their finger to see what their blood glucose levels are. There are sensors available that is measuring their blood sugars every 5 to 10 minutes. These sensors are then communicating with a device that provides insulin automatically.
Right.
So to see this is amazing. Recently I had somebody who just developed type 1 diabetes. She was a 22-year-old girl, developed type 1 diabetes. We saw her in the hospital, in Millet Fillmore Suburban Hospital, controlled her sugars. She came to the center. She works in an aquarium. So her hands were always in water. And for the first time, to be able to tell her that you don't have to prick your finger to check your glucose, That was an amazing moment for me
Right.
to be able to say that.
Exciting.
So it's exciting. What I also tell people with diabetes is, there are treatments in the horizon where there is going to be a time where we maybe be able to implant these cells that make insulin, into your skin.
Right.
And so you don't have to figure out as to, what you should be, how much insulin you have to take, etc. It's going to happen automatically. And my biggest prayer or biggest thing that I tell people with diabetes, just hang on, control your blood sugars, make sure so that you don't develop any complications, because a lot of things are coming in the horizon.
Right.
Even for people with type 2 diabetes, where along with diabetes, we not only have high blood sugars, but some of these people also have some difficulty in controlling their weight. We have these innovative treatments that are available now that will improve their sugars, also help them to lose weight, not increase their risk of hypoglycemia, which is again an important part of treatment with diabetes. So there's a lot of things that are happening in the future.
So an exciting time for practice, an exciting time for treating diabetes. Lots to look forward to on the horizon as we move forward.
Yes, absolutely.
Yeah. Dr. Chaudhuri, thanks for joining us today.
Thank you, Mike.
Thanks again for joining us today. I'm your host, Mike Hughes. We'll see you next time on Medically Speaking.